We've all heard of arthritis, but what is it? Well, arthritis is a condition that affects the joints of your skeletal system. It causes stiffness and painful inflammation of the joints and affects around 10 million people in the UK alone. There are many different types of arthritis, including osteoarthritis, rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, reactive arthritis, and spondylosis. All of these different types of arthritis have different symptoms and affects the body in different ways. The most common type of arthritis is osteoarthritis. This is wear and tear of the joints, and over time and through overuse, the protective cartilage in your joints will become damaged. Here we've got an image of a normal knee and one that's been affected by osteoarthritis. As you can see on this affected knee, there's a much smaller joint space and the bones rub together, causing inflammation in the joint. You can also see bone spurs around the joints. These are called osteophytes and are caused by the rubbing of the joints. Exactly the same as walking barefoot in the summer, and the skin gets hard and thick on the bottom of your feet. So too does the bone where the rubbing occurs. So we get these reactive bone spurs. Sometimes part of the cartilage breaks off into the joint space, which causes more inflammation and irritation. Osteoarthritis typically affects the joints that bear weight, like your knees, hips and spine, but can occur in any joint, especially those that are overused from repetitive movements, such as your hands. Because osteoarthritis is a wear and tear condition, it tends to affect people later in life and those with demanding physical jobs or lifestyles. Also, one side of your body is more likely to be affected than the other. It's more common in women than men and is more likely to occur in people who are obese or smoke, as this puts extra pressure on the joints and in the joints. So what are the symptoms of osteoarthritis? Well, as the joint becomes inflamed, there are usually pain, tenderness, and there may even be visible swelling. You might also hear a grinding sound when the joint is moved. This is called crepitus. You will also notice that the joint is stiffer and doesn't move as much as it did previously. There tends to be pain, tenderness, inflammation, swelling, stiffening, and that grinding noise. Symptoms like these are usually worse first thing in the morning, or if you sit for too long and stand up, and they usually start to ease within 30 minutes. They're also often worse in colder weather. To diagnose arthritis, your chiropractor will look at your medical history and background for risk factors such as a physically demanding job or whether you're a smoker. They will also look at the joint's range of motion for any reduced movement and any swelling or inflammation. Your chiropractor may also obtain x-rays of the joints if they feel this is necessary. Currently, osteoarthritis is not curable, however it is very much manageable with the help of chiropractic care. Chiropractic care of osteoarthritis focuses on correcting the movements of the joints, making sure that everything moves as smoothly as possible. Imagine a car tyre that isn't aligned correctly. The tyres will wear unevenly and one part of the tyre is having to do more work than the other. It's the same with your joints. If they're not aligned properly, then one joint will be working harder and will be more prone to wear and tear. Your chiropractor will look to introduce gentle, specific exercises and stretches to look after your joints in the long term. Your GP may prescribe medication for arthritis, but unfortunately, medication will not have the effect on the damage already done to the joint. They may also try cortisone injections, but the success rate is not 100%. In really severe cases, there may be no other option than to replace the joint, but as chiropractors, we will look at helping you avoid this for as long as possible. So if you want to avoid painkillers, injections or surgery, contact us for an appointment to discuss how chiropractic can help you.